Your attention please. Please take care of your personal belongings.
Namibia, one of the worst HIV-affected countries in the world. It has a current HIV prevalence of 14% in the general population and a maternal death rate of 130 deaths per 100,000 live births. Around 18% of women attending antenatal clinics are living with HIV. People travel for hours to access critical HIV and sexual and reproductive health services, and they often have to return more than once to get all the care they need. Clients were required to return repeatedly to receive all the services they needed. So many clients simply did not go back for the critical HIV and sexual and reproductive health services they needed. This meant that Namibia's response has not been as effective as it could have been in reducing HIV and the maternal death rate. But something is changing. Here at Ipako Clinic, clients see the same nurse on each visit. They are treated in the same room and they receive all the care they need on the very same day, instead of being told to return another day. Simple, right? For clients with private doctors and nurses, it is that simple. But not for public clinics in Namibia, whose clients include about 85% of the population.
This clinic is different from other clinics in the country because it uses a model, one-stop model, where the patient goes to one nurse for all the services. So when the patient goes to the nurse, they can get all their services like HIV, ANC, postnatal, family planning, screening, immunizations, their nutrition, counseling and support just in one room. The patient is not moved for services to other nurses or other rooms.
Studies at Ipako Clinic concluded that the organization of services using one nurse, one patient, one room model has the potential to increase nurse productivity by 2.5 times, reduce patient waiting time by half, and reduce stigma and discrimination, all of which contribute to better uptake of those services. When HIV and other pandemics were devastating Namibia, a system was established to handle the public health emergency. The HIV prevalence rate peaked at around 22% in 2002. The goal now is to end AIDS by 2030, provide universal access to sexual and reproductive health, and reduce maternal mortality.
This clinic, Ipako, is in a very vast region. Omaeke region is very vast, so you find that patients travel very long distances, sometimes more than 200 kilometers just to come to the clinic. So if in the past, the patients sometimes would have to come on certain days for certain services and come again for other services on other days. So it was a bit difficult for the patients, but now they just come that one day, they go to one room, they get all the services that they need.
Because of good progress to date at the pilot sites, the results are to be evaluated by the Namibian government in order to decide if this model for providing integrated services for HIV and sexual and reproductive health should be scaled up. The results so far show that it has the potential to save millions of lives.